By now, you're aware that PDPM is designed to capture patient characteristics, conditions, and outcomes that might influence their care needs during their stay in a skilled nursing facility. You might also remember that there are 5 case mix-driven components that determine the bulk of their per diem payment for resident care during skilled stays. For 3 of those components, PT, OT, and SLP, it is crucial to identify the primary reason for the SNF stay. To elaborate, the following is a reminder of how the case mix decision is made for the PT and OT components. For both PT and OT, it is based on 2 factors: clinical category and level of function. So that very first question is about the primary reason for the SNF stay. For the PT and OT components, residents are categorized into one of 4 clinical categories. In relation to SLP, the question is whether the resident has an acute neurological condition or not. So, for the SLP component, residents are categorized into one of 2 clinical categories. Determining the clinical category for the PT, OT, and SLP components is accomplished by choosing one key ICD-10 code that will be entered in a new field on the MDS called I0020B, or I20B for short.
Keep in mind that this primary diagnosis may be the same as the primary diagnosis for the hospital stay, or it may not be.
The key point is that it needs to represent the primary reason for the SNF stay. The ICD-10 code that is entered into the field I20B will then be mapped to a PDPM clinical category using methodology that CMS has programmed into the grouper software and has made available on their PDPM website. More on that later. You should be aware that if a resident has a recent, pertinent surgical procedure during the prior hospital stay, the clinical classification may be further adjusted by the classification grouper based on additional entries in a revised Section J. These surgical procedures are captured in items J2100 through J5000 on the MDS.
This is important if the surgical procedures are related in some way to the I20B diagnosis, which is the primary reason for the SNF stay.
Now that you know how important it is that I20B field is for determining the case mix per diem for your residents under PDPM, there is another very important point that we need to emphasize.
There are over 65,000 ICD-10 codes, but approximately 42% of them do not actually map to a PDPM clinical category.
Claims submitted with one of these codes in the I20B field will be returned to the provider for recoding and resubmission, which will delay payment. This is demonstrated in the following tables. Take a look at the specified ICD-10 codes. Instances such as difficulty in walking and unspecified nausea with vomiting, for example, will be returned to the provider for recoding. Obviously, there is no way that your staff can keep track of all the possible ICD-10 mapping scenarios. If you utilize some form of an electronic medical record and have a software partner, now is the time to begin discussions with them about how their programming will help your staff to determine the most representative ICD-10 code for field I20B that will also place the resident in a PDPM clinical category that best represents their needs. If you do not use some form of an electronic medical record and cannot consider moving in that direction, CMS has posted the Mapping Crosswalk from ICD-10 codes to PDPM clinical categories. In fact, this is a good time to remind you to keep an eye on CMS's special new PDPM website for any updates or resources they may post there. And as always, check back here on our PDPM Resource Center for more information and support in this ever-changing reimbursement environment. Aegis Therapies is here to help